Okay, so hello everybody. Welcome to the first ever Networking Wednesday hosted by the One Health Student Committee. My name is Sarah Martone and I am an executive member of the OHSC and I will be your moderator for this event. I'm just going to quickly go over the outline for tonight's event. We will begin with a short presentation by Katherine and Devon, who will give you some background into their amazing work. And after the presentations, we will enter a discussion period. And without further ado, I open up the floor to our wonderful presenters, Devon and Katherine.
Okay, so I'm going to start. Katherine and I actually coordinated this, so we thought we would just start by discussing our education backgrounds, the paths our careers have taken so far, and kind of how One Health has been incorporated into our various roles. So I am a creature of habit, and I have done all of my degrees at the University of Guelph. So I started with an undergrad degree in what was then the Department of Microbiology. I think it's molecular and cellular biology right now. And it was during when I was looking for a fourth-year research project, I discovered the Department of Pathobiology. I didn't actually know it existed until I was almost done my undergrad, but I did a research project there on Haemophilus parasuis, so looking at virulence genes in Haemophilus parasuis, which is a bacterial pathogen of pigs. And I did that with Dr. Janet McInnes, and I loved it so much that I stayed on for a master's degree with her. And then I worked for a little bit as a technician before pursuing a PhD, but I ended up doing that with Dr. Scott Weiss, and I looked at gene expression in Clostridium difficile. So I worked primarily with human isolates, but I did some side projects looking at C. diff in food sources and in the environment. And then he had other research going on with C. difficile in various animals. So his lab really did kind of exemplify the interconnectedness between animals and people and the environment. So I really do credit Dr. Weiss with kind of getting me interested in One Health and sort of helping direct my career path. So I actually became interested in the field of infection prevention and control through him. So if anyone knows him, they know he's the Chief Infection Control Officer for the OVC Health Sciences Center, and he had a lot of research interests, and he thought it would be a good fit for me with my interest in C. difficile, as C. diff is a significant concern in hospitals, so big focus of the infection control program. So he actually got me my first job in infection control. So I was an infection control practitioner for the OVC Health Sciences Center, which was a great first experience in the field. While I did that, I volunteered at a couple human hospitals just to increase the likelihood of actually getting a job, as there's more opportunities there. So that's just a good example of, how volunteering can kind of lead into other things. I ended up taking over for somebody who retired who I'd volunteered with and got hired on at Guelph General Hospital. So I worked there for about 4 years, and now I am a regional infection prevention and control specialist with the Central West Regional Support Team at Public Health Ontario. So my job now is to basically support stakeholders with their infection control practices. So working with hospitals, but also long-term care, public health units, retirement homes, especially recently that's expanded quite a bit. So we work with all sorts of groups of people, and we do things like answer their questions. We might develop resources, facilitating network opportunities, might be research, different projects. It kind of changes. And I've always been really interested in staying connected to research. So one way I did that was to become a member of the editorial board of the Canadian Journal of Infection Control. So I did that for about a year, and then when the associate editor position became a position, it hadn't previously been one, I was able to step into that role. So that's been a really great experience as well. So One Health is something that's always really interested me, and I found a connection through all of my positions, I think. So infection control is something good to get into if that's something you want to kind of keep incorporated into your profession. So just a couple examples: when I was working at the hospital, there were pet visitation and therapy animal on, so that was something I had to consider. Right now, Katherine and I are actually facilitating a One Health community of practice. So this was actually a committee that was originally developed by a public health unit, and we're both involved with it prior to coming to work at Public Health Ontario. So it actually evolved a bit, and Dr. Weiss and CPAS have taken it over, and so we continue to support it and to facilitate it. So it's a great opportunity to get leaders from human and animal healthcare together, information sharing, some networking. We have some working groups working on some resources, so there's some really cool stuff there. Katherine and I have also found ways to keep research into our jobs. So we are collaborating with Dr. Weiss on a backyard poultry survey right now. So just asking people who own backyard poultry about their practices, kind of looking at it through an infection control lens just to see if there's any gaps. And then potentially we might be able to take those results and go on to do something else, develop some resources, whatever. And I like to think of Katherine and I as One Health champions in the infection control department at Public Health Ontario. We have done some internal presentations for our colleagues, really trying to kind of get them excited about it and to think about how they can apply sort of a One Health considerations to the work that we do with our stakeholders. So just some defining moments for me related to One Health and how it kind of impacted my career. So as I mentioned, my first job was in infection control at the OVC. This was a really great opportunity to get my foot in the door in the field of infection control, but also to witness firsthand the parallels between infection control programs in an animal hospital and a human hospital. When I interviewed at Guelph General Hospital, they actually asked me several behavioral or like situational type questions where they asked me to provide examples of some kind of experience I'd had. And I was able to answer all the questions using examples from a veterinary hospital, and they found that fascinating. So they really love to hear about, what an active surveillance program for MRSA is like in horses, or what the surgical site infection program in dogs was like. And they were really quite surprised because they had no idea. So there'd be such a sophisticated infection control program in an animal hospital. So I actually think that's why I got the job. And then when I started working at the hospital, I was given the job of developing policies related to pet visitation and therapy animals. So it seemed a lot easier just to keep animals out of the hospital, but certainly we had occasions where we had a dying patient who wanted to say goodbye to their pet. So we had to kind of figure out how we were going to make that happen safely. And there was such interest in having animals coming into the hospital that we did decide to look at a therapy dog program. So kind of applying an infection control lens to how we were going to be able to incorporate that safely. And that picture on the bottom there is just sort of an example of how One Health has kind of impacted me personally. So that's my dog, Buster, and that's my little guy, Camden. And about 3 years ago, Buster was diagnosed with leptospirosis. And just having worked at the OVC, I knew lepto was potentially zoonotic. So one of my first questions to the vet was, what is the potential risk to my kids? So as you can see, my kids have a very, very close relationship with this little dog. So the vet was quite candid about that, and he said he actually didn't know. He didn't know anything about what the risks might be to people. He had never even thought about having that conversation with the owners of the dogs that had been diagnosed with lepto, and he really didn't know what to tell me. So that was just kind of a good example for me anyway, highlighting sort of the need to continue to kind of keep a focus on One Health implications in both a veterinary and a human healthcare setting. So just some different examples of how I've been incorporating that into my job. So I will turn this over to Katherine now, because Katherine has a very interesting background.
Thanks, Devon. So I should add, I actually followed Devon to PHO because we worked together in our previous roles. When she was an ICP at Guelph General, I was on the communicable disease team at a health unit, and she was so fun, I decided I had to work with her. So I followed her to PHO. And now we have lots of fun at the same place. So I am not as much of a stickler with the same place. I'm a little bit more eclectic than Devon. I did start at the University of Guelph in a Bachelor of Science in Animal Biology. I actually wanted to become a vet, but found out in my 4th year after I did my MCATs and went through all of that, that I'm actually anaphylactically allergic to both cats and horses. So vet school was out. So then I did a Bachelor of Applied Science in Public Health and Safety at Ryerson. I did a Master's in EPI at the University of London School of Hygiene and Tropical Medicine in England. I did it distance though, but I did get to go over for graduation, and my degree was conferred by Princess Anne, so I had to curtsy to get my degree, which was pretty cool. And then I'm currently a PhD candidate in the Department of Pop Med. My advisor is David Pearl, and my research focuses on salmonella outbreak detection and outbreak management and things like that. So I've tried to make it a One Health focus, and one of my topics for my qualifying exam was One Health. So it's pretty cool. I've tried, like, if you look at my education, I've kind of bounced around a bit between animal and human health. My master's did have a human focus, but my PhD has kind of a One Health focus. So I've tried to make sure that I kind of bring it together cohesively so I don't lose anything. So career-wise, I certified as a public health inspector through the Canadian Institute of Public Health Inspectors. It's a lifetime designation. So to get that, you do have to have the degree in public health and safety. So that was my purpose for doing that one. I'm also an epidemiologist, and I worked at Wellington Dufferin Guelph Public Health on the control of infectious disease team as a public health inspector and the backup infectious disease epidemiologist for 8 years. And I was also a meat hygiene officer at OMAFRA, because when I first graduated from public health and safety, there were no jobs in public health. That happens sometimes. There's kind of lulls. So I fell back on my animal biology and enforcement background and did work there for about a year and a half before going to be a health inspector in EPI. And then I followed Devon to PHO, and I've been here for, I think, just over 2 years. So I also try to apply One Health to everything that I do. I love research. I love writing papers. Really excited to do our One Health projects that we have been able to do at PHO successfully. So as Devon mentioned, we do have our backyard poultry research. My own personal research also focuses on outbreak detection and salmonellosis. So I'm excited about that. And again, I've tried to bring that into my research as well. So my current research is on salmonella and looking at meat plants, trying to bring together my own experiences and things that I'm interested in. As Devon has mentioned, we do develop a lot of resources, and we have some communities of practice where it's really cool to be able to bring together people from all these different facets of academia and from their professional lives, and then share their experiences. And it's really interesting to hear some of those conversations and some of the connections that are made through those. So that's really neat. So we thought a good way to structure this would be, when we were thinking about what we would speak about today, I was really thinking, like, I've had some really defining moments in each of my professional roles that I thought I'd share with you. So if you've heard Devon and I speak at CFAS before, you've probably heard me speak about some of these. It's basically a chronology of my career in pictures, but I'll try to keep it quick. So when I think back on each of my previous roles with the One Health focus, these are the highlights that have stood out to me. And I really credit these with shaping both my academic and professional careers, because these were really impactful on my life. So as I mentioned, when I graduated animal bio, I didn't know what to do. If I wasn't going to be a vet, I didn't really have a backup plan. So I actually ended up working in a long-term care for 3 years. And it wasn't the funnest job I had. Like, I loved working with the residents, but it really was not in line with my professional goals and what I'd gone to school for. And one day I was working and the public health inspector came in, and he was really great and really charismatic. I was petrified and like polishing silverware with vinegar, which we never did. So I wasn't sure how I would explain it when he asked me why I was doing it when he came in for inspection. But we actually had a really good conversation. And from that conversation, he's like, you should go into public health inspection. There's a lot of animal focus, a lot of human. It's really enforcement based, a lot of variety. You'd really like it. So based on that conversation, that's exactly what I did. So fast forward a couple of years, I was a PHI, and there were no jobs in health inspection, as I said. So I ended up being a meat hygiene officer at OMAFRA. It fell back on my animal background, but still brought in the public health side of things. So I thought that was a pretty good fit while I waited for there to be some more public health jobs. And in my first couple of weeks of in-class training before going out to a white meat plant, they were going through some general information orientation, and they just kind of matter-of-factly threw in there, like, every single one of you guys, when you start working in a white meat plant, is going to get Campion salmonella. Kind of is what it is, accept it. And they moved on. And I was like, wow, like, I'm a public health professional. I'm not going to get sick. I was like, okay, whatever, sure. That's probably most people, but not going to be me. Started working in a plant, turned to ask somebody a question beside me, got a chicken foot dragged through my mouth, and got a raging case of Campylobacter. So it was a statistic exactly like they predicted. But after I left OMAF, I went to a health unit. One of my roles at the health unit was to do reportable disease case management and outbreak investigation. And I very quickly realized that there was definitely some potentially overlooked pathways for human illness, because even though we asked people a lot about, where do you work and what do you do, there wasn't a lot of emphasis on, like, I knew there was a lot of salmonella and campi associated with working in slaughter plants, and I knew there were a lot of workers in our area. So you would think you would see more people reporting that as an exposure, but then it got me thinking, like, if you know that you're going to get something like that, and then you develop symptoms consistent with that, maybe you're not going to seek medical attention, which really is contributing to the underreporting and kind of like an overlooked pathway of illness, where when we're working in public health prevention, we might not think about it so much. So that's kind of motivated my research as well. And I thought that was pretty interesting. So the picture on the top right is not me, but that's, again, meat and public health inspection have really intersected in my career, which is interesting. I would never have thought that those two things would come together as many times as they have. But there was one particular outbreak I was involved in associated with a family barbecue that involved a whole pig. And I realized from the inspection legend when we did our investigation and traceback that I actually knew the plant because there's an identifier on the carcass. And it was a plant that I'd worked at. So I was able to give some insights into processes and types of animals processed. And like we could really dig into the factors that might have contributed to this particular outbreak. I was like, oh, this is really cool. This is really where you see these things coming together and where they can intersect, and you can think about each of them and apply them from a One Health perspective. And it can really get you to a different place because when you're actually working through outbreaks in real life, it's actually very rare that everything aligns and you know exactly what happened and you've got leftovers to test and you can actually figure out conclusively where something started. So this was a really defining moment for me in my career, and it's actually what made me decide to pursue a PhD in epidemiology, because I was just like, this is awesome. I'm so interested in it. And that's probably what's kept me going for so long, because I've been in school forever. But I am interested enough that I've stuck with it, and I'm really interested in the research that I'm doing. But again, that's something where I would never have thought that I would combine those particular skill sets or experiences. But now that I look back on it, I'm like, I was doing One Health without even really realizing it. So on the bottom left, that's a fish pedicure with Gararufa fish. So one of my responsibilities at the health unit and in my current role is I do a lot of work with personal service settings. So anywhere you can go get a haircut, tattoo, piercing, manicure, and occasionally we get operators interested in offering treatments involving animals. So things tend to pop up in the US or Europe and they get a lot of attention and they're kind of trendy. And then they usually move over to Canada. So for PSS, that kind of made us realize there wasn't anything. There's always been best practices for the last 20 years or so. There's been best practices for infection control and personal service settings, but there was nothing really in these pertaining to animals. So it was really neat. And then you'd have conversations with people wanting to bring in a fish and be like, it's not really like a nail file. You can't really disinfect it. So how are we going to mitigate the risk going person to person? There's been some big outbreaks associated with this. So about 7, maybe 5 years ago now, I was given the opportunity to be one of the authors contributing to the provincial best practice document for IPAC and PSS. And this is the document that is now adopted by law, and every personal service setting operator has to follow it. So it was really cool to be able to contribute to that. And one of the contributions or suggestions that I was able to bring forward was that we should think about having some stipulations regarding animals in PSS. And that's exactly what ended up happening. It was very exciting, made it into the final document, and is now actually referenced in law. It is now not legal to have animals in a personal service setting other than a service animal. So it was pretty cool to bring together different experiences and expertise and be able to contribute directly to best practice and to provincial practice. So on the top middle, when I was working as a health inspector, one of the other things we did was go into childcare centers to ensure compliance with IPAC best practices again. And one of the things that came up a lot that I had never really thought about was classrooms wanting to have baby chicks and incubators and hatch them and have the children learn about the life cycle and everything. Really cool, but a lot of risk carries with that. As well, long-term care homes and other settings like to have backyard poultry in the summer. So as you can see, that's led into our current research because it's interesting. So really a lot of things that you start thinking of in terms of mitigation and risk, and then you start bringing in the One Health perspective, you're probably doing it a lot without even really realizing that's what you're doing. So we've had some really interesting conversations. And then when you look back on it through a One Health lens, I'm like, oh my goodness, I was doing One Health. And then at the bottom, this just relates to our current role at PHO. We get a lot of inquiries from various settings, as Devon said, with therapy animals and pet visitation. So one of the things that made an impact on me when I was at the health unit was I went in to go do a routine inspection of one of the long-term cares in my area. And one of the staff members ran up to me and was all proud, and look at this, showed me their newsletter. They'd had an exotic animal petting zoo come into the long-term care the week before. And there was a picture of a little old lady sitting with a crocodile over her shoulder, just smiling in a wheelchair. And I was like, oh my goodness, you've brought in all these animals indoors on carpet. There's no hand hygiene anywhere. This little old lady is stroking the crocodile or whatever, alligator, I can't tell them apart. And then she's probably wheeled back through the facility. There's probably salmonella everywhere. Oh my goodness. I'm like, you guys didn't call me. You didn't think to ask me before you did this. Oh no, but it was great. So that really made us realize, like, you'd never really think that there might be animals in a long-term care, but as Devon gave the example of the hospital, there's actually a lot of different ways animals might be present in settings that you might not necessarily think of. So in form of service animals, pet therapy animals, backyard poultry in the summer, just to give like a resident enrichment experience. So it's really let us have some interesting conversations with our colleagues and our stakeholders and look to think about things from a different lens and create some resources that maybe weren't in existence before. So it's pretty neat. I think that was it. Oh, and one of the other things that I've noticed from doing case management and having these conversations is, even though when you do a case management investigation and say somebody has E. coli or Campylobacter or something like that, one of the questions on the standardized questionnaire that the health units use is about animal contact. And it's just a generic question like, have you had contact with any animals? And I thought it was really interesting that people would say no to that question. But if you specifically ask them, do you have a cat or dog? Oh, yeah. Because people consider their pets, their household pets, as family members. So if you ask them generically about animals, people don't necessarily disclose that, even though it's a risk factor, and we know it's a risk factor. I think it's really interesting to think that people consider their pets more family members. And if you ask about animals, they won't make that connection and tell you some of those things. So just some interesting things that I've learned along the way and I've looked back on through a different lens and try to bring to my current practice and conversations. So I think Devon and I get to do some pretty cool stuff, and we've been able to convert a bunch of people to having a One Health interest. That's about it.
Thank you guys so much. That was amazing. And those pictures are very good at just sparking some of that, like hammering at home some of those ideas. And I definitely never really thought of therapy animals, like the variety of therapy animals, I should say, like llamas and reptiles, as you mentioned. If anyone has any questions, there's a little hand that says raise your hand, and feel free to put that up. And I'm going to ask a question first because I can. So this is for both of you guys. How has using the One Health approach improved your work or research throughout any of the different roles that you've been a part of? Or when did it first become apparent that it was going to benefit your research and your work?
I can go first if you want, Devon.
Yeah, good.
Yeah, as I said, the outbreak that I worked on was pretty early in my public health career. I think it was about 10 years, I'm aging myself, like 10 years ago now. But it honestly made such a huge impact on my career. Like I would say that was my defining career moment. Like it would never all come together for me until I was involved in that. And I was actively involved. I did all the analysis, interviewed everybody. As an inspector, went out, did all of the inspections, collected leftovers. Like I was involved in every single step of the process, which I think is rare that you get that kind of an opportunity to see it through from like initial conversation all the way through to the analysis and report and feedback. And I'd never, like, I think all of these different things, or like academically, I'd learned all the different, like I'd taken courses on environmental stuff, on animals. I've got degrees in animal stuff and human stuff, but I'd never actually applied it all together in one situation like I did in that scenario. And it was kind of like a light bulb going off, like, oh my goodness, like I'd always thought of my previous roles or education as like, hey, I learned this. So in this job, I'm kind of relying on this degree, and in this job, I'm kind of using this education. But it really opened my eyes to how like they're not mutually exclusive, and you can kind of bring all of those things together and all of your learnings and experience and apply them all together. And it really, I think, has made me a better practitioner for it, because it forces you to take a step back. Otherwise, it's really easy when you're working on something to get tunnel vision, or to have an idea and be like, oh yeah, it's got to be this, and go down that pathway in your head. But I think it's really forced me to take a step back on everything and think about things from a broader lens, and taking into, like, just look at things from a broader perspective. I don't know. I think it's made me much better at what I do. I'm sure Devon's had the same experience.
Yeah, so for me, it probably started when I first started working in infection control at the animal hospital. So there was a bit of an assumption working with animals that your infection control program would be to protect your patients, which tends to be, how people look at programs in hospitals. But there was such a big factor that was sort of missed by a lot of staff and just other people, that it was actually a big part of it is protecting the staff from the animals and the animals from the staff, because so much was shared. So that was really kind of hammered home to me then. So then when I started at the hospital, immediately realizing there wasn't a pet visitation policy in place and things like that, I was able to kind of introduce that. And so, yeah, I do feel that, we kind of have that advantage in being able to apply that lens to things. And then for Katherine and I, the One Health stuff in our department, it wasn't all that frequently done. So I feel like we've been able to really focus on something that's a bit new and introducing some kind of interesting new ideas and new aspects to infection control that hadn't been previously done. So I feel like, a lot of people appreciate that because it's kind of interesting. So yeah, I definitely think, similar to Katherine, it's definitely improved coming at the field of infection control, having that experience and that knowledge.
We have lots of ghost stories. People always like ghost stories. So we've got that hook to get people interested.
Definitely.
All right, so we have a question from Danny asking, what would you say is the most difficult part of applying a One Health approach to your roles?
Convincing other people.
I was just going to say that. That's probably one of our biggest challenges. Where we work, I mean, a lot of smart people work there with a lot of great ideas. We've got a lot of priorities, a lot of projects on the go. And that's something that Katherine and I are challenged in doing, is presenting some of these projects and things we want to be involved in a way that that they'll embrace and say, yes, here are the resources you need, or even if it's just us, letting us do it. That's I think we've been pretty successful, but yeah, that's definitely, sort of introducing something new is always a bit of a challenge that way, but yeah.
Convincing them to see the benefit, or like, don't we do that already? And then you have to go, well, no, actually, we're very human centric. So yeah. It's interesting because then it's an opportunity to educate, and then they're usually like, oh, that's really cool. I haven't thought about it like that.
Yeah.
All right, we have another hand. Saeed?
Yep, thank you. So I just wanted to ask, what kind of skills you guys think that help you to make progress in your careers?
So I can start. What I have found, one of the most important skills to have actually are the soft skills. So I think the ability to form really good relationships with people goes a really long way when it comes to, convincing people to do things or letting you do things. I'm sure Katherine probably feels similar. Having those relationships with people really facilitate the collaborations that you need to kind of move things forward. So that's something I found even back when I worked in the hospital, sort of forming those relationships with the nurses or whoever, and especially with infection control, sometimes you're asking people to do something that will be looked at as like more work. So you really kind of need the buy-in, you need the trust, you need those relationships. So that's something it's something that comes natural to some people. Other people need to work at it a little more, but definitely I feel like that's something that's benefited me a lot, is just the ability to form some really good relationships and sort of to move your work forward.
I agree. That and being a good communicator. I'd say the professional me now compared to 10 years ago, I was really quiet and timid and didn't feel confident to share my ideas. Whereas I think you have to have confidence in your own knowledge, and then have, like Devon said, soft skills and be a good communicator, because you really need, I think, where we are at right now with One Health is you need to convince people of the worth and let them see your vision in order to get ahead at all for that. And then career-wise as well, it's a lot of networking and being able to communicate with people and share your ideas and collaborate is really important.
Great. Thanks for all the answers. I really enjoyed both of you, your stories about like your journeys, starting from, for example, animal biology and then leading to public health inspector, or in other presentation from OVC to regional infection control professional specialist. It was very interesting to me. But another question I have, I just wanted to make it short. It's that what was the society's reaction to you guys, to the One Health approach? So I mean, it's a new field, it's a new approach to the health. So I'm just asking to see like what kind of reaction people had when you had this approach.
I feel like when we started talking about it in Public Health Ontario, people were pretty positive about it. I think they didn't really think about the fact it's always been there. It's just we were kind of pointing it out as something that, you know, you can deliberately look at and do research in and kind of apply principles to. But I mean, the animals in healthcare settings have been there for a long time, so they kind of recognize, oh yeah, that is something that we need to consider. But I feel like the feedback we've gotten so far has been quite positive. And even when I was at the hospital and I started talking about, you know, the pet visitation policy, they were pretty positive about it. I guess there were definitely some people who didn't like the idea, you know, of being a little bit more restrictive because we did have, you know, certain rules in place. But overall, I feel like it was pretty positive and people tend to be pretty excited about it. After Katherine and I did one presentation internally, I had somebody who works in Ottawa actually call me and say, you know, if there's any way to be involved with that, she'd love to do it because it's something that just really got her excited and interested. So I feel like it's been pretty positive. I don't know. What about you, Kat?
I think so too. And I think it's like exactly what Devon said. She nailed it. Like people think when you first bring it up that it's some new thing that you're trying to sell them on. And the initial reaction is, oh, I don't have time for that. But then when you explain it more, like we usually start our presentations with a definition and try to explain more that it's a paradigm and it's not something new. It's more a different approach or a different way of thinking of things from a broader perspective or a more interconnected perspective. And then once you say that and let that settle in, and then you give some examples, then people are like, oh my goodness, you're right. I hadn't thought about that. So it's pretty cool to see that thought process and to see the conversion happening. And then like Devon said, it leads to some really interesting conversations or collaborations, it's so cool. We need to start doing more of those, Devon. We haven't presented on it internally for a while. It's been busy.
Yeah.
Yeah, great. Yeah, thanks for all the answers. Thank you.
You're welcome.
Okay, so Danny asks, has COVID-19 noticeably changed the way coworkers perceive a One Health approach?
Not for us, but I know Scott Weiss has done some awesome presentations and has some awesome, I think he's got some presentations online about this. So I actually go and read his things for that angle. Our focus in that regard is definitely human focused, and it's just, there's no time. Maybe retrospectively, that would be something that would be looked at from like a research angle, but it's just not the stage that we are in. But that's definitely something I know Scott Weiss has had a lot of input into, which is really neat. We try to follow closely what he does. We're fans.
Yeah.
Okay, so Liam says, it's great to hear from both of you as a microbiology undergrad considering the Ryerson program Epi Masters afterwards.
Ooh, the Ryerson Public Health Inspection Program? You're welcome to connect with me directly if you want. I can give you all the information on that. I'm actually on the board of certification for the Canadian Institute of Public Health Inspectors, so I'm an examiner. I wouldn't be allowed to be your examiner if we connect, but I can give you a lot of information on that, and I do mentor some students. But yes, you're more than welcome to share our contact info. You can actually look both of us up in the University of Guelph directory. Devon's adjunct faculty and I'm still a student, so we both appear there. I think you appear there, right, Devon?
I should, yep. I think so.
Public health inspection is an awesome job if any of you guys are interested. You do have to have a degree in public health and safety. There's 6 schools in Canada. So Conestoga recently added a Bachelor of Environmental Health program, and there's one at Ryerson. So you might seem weird that I've got 2 bachelors. It's just because you have to have that degree to do that job. But there's a lot of people that go to it after a PhD or after a medical degree overseas and things like that, because it's a really neat job. You get to do a lot of case investigation, outbreak management, if you specialize in CD like I do, or on the environmental side, you do a lot of water quality, rabies, health hazard, that kind of stuff, a lot of food safety. It's a really cool job.
Is it a full 4-year degree?
Oh, that's a good question. So it is if you're coming out of high school, but if you're coming and you already have a degree, you can apply for a 2-year fast track, which is what I did. So you do a 4-year degree in 2 years. It basically means you have a double course load. So instead of 4 classes a semester, you have 8, but you can get transfer credits. So with my animal bio, I think I only got 3 equivalency credits. So I had 7 classes most semesters, but it's totally doable.
Oh, nice.
Yeah, so less than 2 years, basically. It doesn't go over the summer semester. You do the degree, and then you do a 4-month practicum with a health unit, which is paid, in order to be able to sit your qualifying exams. And then to certify, you write 2 scientific papers, which are marked by an examiner. And then you do a 90-minute oral exam. which is 12 questions on anything and everything related to the program. So it could be a water quality question, followed by an outbreak question, followed by a PSS IPAC question, followed by childcare, followed by something about perchloroethylene in a dry cleaners. Like anything is fair game. It's really cool, but like it's an awesome job. I would do it again.
That's awesome.
And it's a lifetime designation if anybody's interested. Oh, Devon, we didn't tell them about the CIC. So we didn't tell you guys. Devon and I are both certified in infection control. So we both have our CIC, which is an international designation in infection control. And if any of you guys are interested in working in infection control, it's really a good designation to have because it opens up opportunities as an infection control practitioner in a hospital. Currently, I've seen there's a lot of job postings for infection control practitioners in long-term care. You can work in a hospital, you can work in long-term care. Devon worked at OVC in the animal side. It opens up a lot of really good jobs. You do have to recertify every 5 years. And there's some criteria for being eligible to sit the exam. Like I can't remember off the top of my head. You have to be working in a certain role where infection control is part of your job and stuff like that. But there is a new designation that they've just introduced as kind of like an entry-level step towards certification, the associate IPT.
Yeah, something like that. Yeah.
And
So I encourage
Sydney?
you to look into it.
Thank you guys so much. Sydney, go ahead.
Hi guys, I just want to say thank you so much for those presentations. It's really interesting to see how both of you took different paths that ended up in the same place and how you use your skills to include One Health from your various perspectives. I really appreciate that because we're trying to get students involved from all different backgrounds, and having multiple degrees helps us see that within ourselves. I don't know if you can comment on this or not, but I was wondering if you've seen any public health policy recommendations coming down the pipeline that better include the One Health perspective in regards to COVID-19, or just things that we can look forward to and can look up.
Not that I'm aware of, but policy stuff usually comes from the ministry, which is the policy branch. So we wouldn't be involved in that professionally.
Okay.
I think we did have Public Health Ontario had one resource related to pets in the home and some recommendations about what to do if somebody's sick, but as far as policies go, I haven't heard anything.
Yeah, so our role at PHO, we're the science and technical branch of the Ministry of Health. So our role is really the science and technical. So the ministry writes the what to do and we write the kind of how. So like for PSS, the ministry has a regulation for personal service settings, whereas we wrote the technical guide to infection control, which explains the how to meet those, like the outcome-based stuff. So that's kind of how we fit together.
All right, thanks. Actually, you just mentioned that. So I think you said that you were able to include some dialogue or some description on how to better consider animals within the public service or public, was it personal service that you said? Policy?
Yes.
Documents? So how did you facilitate those conversations, or how did you convince your colleagues to incorporate something like that?
So we wrote the best practice document. I can't even remember how many years it took. It came out in 2019, and I was on the group that authored it. You can look at it publicly. It's publicly available online, and it's the documents like the infection control guide that all PSSs have to be in compliance with. And when public health inspectors do their annual inspections of PSSs, that is what they're looking for, is for compliance with that document. And it kind of fits in with the regulations. So like the regulation says you must sterilize your instruments. The document tells you how often you have to spore test and like what type of autoclave you can use and things like that. So when we were writing the document, we started with what did we like about it? Because there was a pre-existing version. I think this is the third iteration. Where did we see the gaps based on, because it was co-authored by PHO, and I was actually at a health unit when I was one of the co-authors. I was on the health unit side. So it was, where did we see the gaps? Where did we wish there were things that were in the document when we were doing our inspections? And one of the things that I'd flagged and that others agreed with was you'd go into a premise and someone might bring their pet dog to work, for example, and it's running around. And there was nothing we'd say, yeah, you really shouldn't have your dog at work. And the immediate response is something like, well, show me where it says that. So I'm like, now I can show you where it says that. So that was something we were able to put in there. And then, for example, the fish pedicures, there was actually a large outbreak. I think it was group B strep in the UK associated with the fish pedicures, because obviously they're living things. You can't disinfect them. Like normally the requirement, if something's used on somebody, is for it to be single use and discarded after use or reprocessed, depending on the level of invasiveness per Spalding criteria. So either low level, intermediate, or high level disinfected or sterilized, depending on if it's penetrating skin, whatever. You obviously can't do that with a fish. So that was something that I had a few operators express interest in doing here. But then when we were writing the document, that was something we were able to see to highlight as a specific example of where you might not want to incorporate animals in a service. And then when the regulation was written, that was something that actually made its way. So Gara Roof with the fish pedicures are actually banned now under the Health Protection and Promotion Act. There's specific procedures that are banned by law in the act, and that's one of them, which is pretty cool. But it's usually based on anecdotal. These are where, or in my experience, it was based on these are where I wish I had something behind me to back up what I was trying to advocate for. And then you can go to the scientific and technical literature and make a case for it. And then if others are in agreement, that's kind of how you're able to successfully argue some of these things.
Very cool. Thank you.
Did I answer your question properly?
Yeah, you definitely did.
Sorry, I go off on tangents.
No, that was great. Sarah, I know that we had a couple extra questions prepared and I made us go over time. Sorry.
No, that's okay. Does anyone have any last minute cues they would like to ask?
You're welcome to reach out to us directly. Our emails are in the directory, or we can share them. I'd love to chat to you about Ryerson or any of the things I've done, as would Devon, I'm sure. So feel free to connect if there's anything you think of or you'd like to talk about.
Definitely.
All right. Well, with that, thank you both so much for kicking off our amazing networking nights. And yeah, it was a great time. And everyone is free to be on their way.
Thanks so much for having us. That was fun.
That was fun. Yeah.
That was great. Thank you guys so much.
Have a good night, everyone.
Bye.
Bye.
Bye.